Hello, how are you? My name is Kwame, Dr. Kwame Otuo Achampong, and I'm here to talk about the management of gingival hypertrophy in orthodontic patients. This is a literature review, also with the PI, Dr. VJ Shiver. Gingival hypertrophy, also called gingival overgrowth, has garnered a considerable amount of attention amongst orthodontists and researchers. The condition involves enlarging gingival tissues to an uncomfortable or problematic extent. It is particularly challenging for orthodontists as the appliances used to correct malocclusions can contribute to the development of the condition or exacerbate its symptoms. The interplay of mechanical, microbiological, and immunological factors contributes to its complexity. As an objective of this literature review, the literature review explores the potential causes of gingival hypertrophy in orthodontic patients, examining the roles of mechanical irritation, microbial changes, and immune responses. The review seeks to provide a holistic understanding of the condition. It evaluates management approaches discussed in the literature, emphasizing the importance for an integrative strategy for addressing gingival hypertrophy. Within the methods of putting together this literature review, it was conducted with a multitude of academic bases, including PubMed, Scopus, and Google Scholar. The key words used were gingival hypertrophy, orthodontic treatment complications, and periodontal pathogens, inflammatory cytokines, and management strategies. The search was limited to studies published in English from 2000 to 2023. The inclusion criteria included in this review were peer review articles that discussed the etiology, pathophysiology, and management of gingival hypertrophy in orthodontic patients, reported on clinical trials, observational studies, and systematic reviews related to the mechanical, microbial, and immunological aspects of gingival hypertrophy, examined the effectiveness of various therapeutic interventions ranging from non-invasive techniques to surgical treatments. Articles did not that meet exclusion criteria were articles that did not specifically address gingival hypertrophy related to orthodontic treatment. Studies focusing solely on non-orthodontic induced gingival overgrowth, or commentaries, editorials, and non-peer-reviewed conference abstracts. There were three main articles that were also used in order to gain the results of understanding the management of gingival hypertrophy in the orthodontic patients. The first was Gong et al., which investigated the clinical, microbial, and immunological factors associated with orthodontic treatment-induced gingival hypertrophy. The study involved 24 adolescents undergoing fixed orthodontic treatment and assessed clinical parameters, including plaque index, probing depth, and gingival hypertrophy index. Results revealed that PI, PD, and HI respectively were significantly higher in the test group than the controls, indicating a strong correlation between orthodontic treatment and the development of gingival hypertrophy. Elevated levels of interleukin-1 beta and transforming growth factors were detected in gingival crevicular fluid of affected patients. These cytokines were identified to be key contributing factors to the inflammatory response and subsequent tissue overgrowth. The study concluded that effective management strategies must address microbial and immunological factors implicated in the pathogenesis of gingival hypertrophy. The next study of 2015, Kwame et al. Investigated the non-surgical management of post-orthodontic gingival enlargement using intensive cause-related periodontal therapy. This case involved a patient with severe gingival hypertrophy who underwent oral hygiene instructions, scaling, root planing, and regular follow-up visits. Over 5 weeks, the patient's gingival overgrowth resolved entirely without surgical intervention. The study highlighted the effectiveness of non-surgical strategies, particularly when patients adhere to a rigorous oral hygiene regimen and comply with treatment plans. It's emphasized plaque as a primary etiological factor and underscored the importance of patient education and consistent follow-up to achieve long-term goals. In the last study, study 3, Robo et al., examined the role of oral microflora in patients experiencing gingival hypertrophy caused by fixed orthodontic appliances. The study found that these appliances significantly altered the oral microbial environment, increasing the presence of pathogenic bacteria such as strep A. This microbial shift in mechanical difficulties in maintaining oral hygiene contributed to the persistence and severity of gingival hypertrophy. The findings emphasize the importance of managing this microbial component. This is particularly true in patients with fixed orthodontic appliances. The study recommended additional antimicrobial therapies to try to control bacterial load and reduce inflammations. The measures taken were shown to enhance treatment effectiveness and minimize the risk of occurrence. And so, to conclude, gingival hypertrophy remains a significant challenge in managing orthodontic patients, particularly those undergoing treatment with fixed appliances. This condition arises from an interplay of mechanical irritation, alterations in subgingival microflora, and immune-mediated inflammatory responses. Mechanical irritation caused by orthodontic appliances creates an environment conducive to plaque accumulation, triggering inflammatory processes that lead to tissue overgrowth. Additionally, shifts in subgingival microflora, including the proliferation of pathogenic bacteria such as strep A, further exacerbate gingival hypertrophy and complicate treatment efforts. Management strategies require a comprehensive and integrative approach. Non-surgical interventions such as periodontal therapy and consistent oral hygiene practices have effectively resolved mild to moderate cases. However, compliance remains a critical factor for the success outcomes. Severe cases often necessitate surgical interventions such as gingivectomies, particularly in cases of significant fibrosis where non-surgical approaches are insufficient. Advances in surgical techniques such as diode lasers, gingivectomy offer promising alternatives, reducing post-operative discomfort and faster recovery times. Histological studies have highlighted structural changes, including collagen remodeling, as key factors in gingival hypertrophy, reinforcing the need for targeted therapies. Furthermore, understanding genetic predispositions such as cytokine gene expression variations may help identify patients at greater risk and inform personalized treatment approaches. Adjunctive antimicrobial therapies also play a vital role in managing bacteria-induced inflammation and reducing recurrent rates. Thank you so much. We will continue to do more studies in understanding the management of gingival hypertrophy in orthodontic patients, as it's very important for the patient to have not only a comfortable experience during their orthodontic care, but a healthy one as well. Thank you so much.